Paget's disease, which is also known as the osteitis deformitis. So, what is the Paget's disease? It is due to the cell problem in the cell, that is the osteoclast. In the osteoclast, it is due to the increased function of osteoclast. So why there is an increased function of the osteoclast? Either it may be due to the viral infection or trauma or due to the genetics. So this increased osteoclast causes increased bone turnover. That is, resorption increases and osteoblastic activity also increases, leading to the what? Enlargement and thickening of bone, known as the osteitis deformitis. So as the osteoclastic activity increases, the markers of the osteoclast also increases. At the same time, increases the osteoblast, and the markers of the osteoblastic activity also increases. So these results to formation of the bone, which is a oven bone, mosaic oven bone, which is usually brittle. It's a brittle bone. So it affects more commonly 40 to 50 years age group individuals who are males. More commonly involved is the pelvis and tibia. So three phases are present. So first phase is the osteolytic phase. Here the osteoclast activity will be more. So leading to the bone resorption. In the skull, we see the osteoporosis, that is circumscripta. In the long bone, due to the bone resorption, we see the candle flame or the blade of grass appearance is seen. And the second phase is the mixed phase, where the osteoblastic activity also starts. So because of the osteoblastic activity has started, here the normal lamellar bone is replaced by the haphazardly woven bone. So in the skull, we see the cotton wool appearance, which resembles the new bone formation. In the vertebrae, we have the ivory vertebrae, which is also known as the picture frame vertebra. We see this is the vertebra, which is of central will be black picture, frame will be of white color, central will be of black color. So differential diagnosis of the ivory vertebrae are the rugged jersey spine. So rugged jersey spine, you see this is the spine. It is central will be of black area. In the adjacents are the white in color. So where we see this rugged jersey spine, mnemonic is a group, that is brown tumor, renal osteodystrophy, next over osteopetrosis. And the third phase is the blastic phase, which is also known as the sclerotic phase, which is the burnout phase of Paget's. Here the bone will be hard, dense, and the less vascular. So this will lead, as the sclerosis will lead to the complications. First complication, because of the spinal stenosis, leading to the compression of cranial nerve 2, 5, 7, 8 compression, and also risk of pathological fractures increase of this serum calcium because of the prolonged bed rest, and also the deafness due to the nerve compression, then the otosclerosis, osteoarthritis, increases the risk of malignancy, which are the osteosarcoma is the more common complication of this Paget disease, fibrous sarcoma, chondrosarcoma, and also the sarcoma of myeloid and mesenchymal elements, and also the high output cardiac failure. And the treatment will be of drug of choice is the bisphosphonate, out of which zoledronic acid is preferred. Next, salmon calcitonin is more effective than procaine calcitonin. So this is about the Paget's disease. So Paget's disease, which is also known as osteitis deformitis, what is the main problem in the Paget's disease? It is an increased function of the osteoclast activity. Why there is an increased function of the osteoclastic activity? It is due to the viral disease or the trauma or the genetics. So increase of the osteoclastic activity causes increase of the markers of the osteoclast will be increased, and further causes increase of the osteoblastic activity. Marker of that is the alkaline phosphatase activity will be increased, leading to the mosaic bone or the over bone, which is usually brittle. So, what happened here? It is increase of the bone turnover with enlargement and thickening of the bone is seen, which is also called as osteitis deformitis. More commonly seen in the 40 to 50 years male. More commonly, the pelvis or the tibia is affected. It has three phases: is in lytic phase, mixed phase, blastic phase. So, lytic phase is seen at the skull, known as circumscripta. At the long bones, we see the canine flame or the blade of grass appearance. In the mixed phase, normal laminal bone is replaced by the hazardia ringed oven bone. In the skull, we see the cottonwool appearance because of the osteoblastic new bone formation. In the vertebrae, we can see the ivory vertebrae or the picture frame vertebrae. Picture frame vertebrae, center will be black, peripheral will be white. And differential diagnosis is the rugged spine. Here, the central black is present. Adjacent areas are the sclerotic, which is white color. So, rugged spine is seen in the brow, that is brown tumor, renal osteodystrophy, and also osteopetrosis. In third, it is a blastic phase, which is a sclerotic phase, which is bound out phase of the Paget's. Here, the bone becomes hard, dense, and least vascular. And sclerosis leads to the complications, more commonly the spinal stenosis, cranial nerves 2, 5, 7, 8 compressions, and pathological fracture due to prolonged bed rest, leading to the increase of the serum calcium levels, and deafness due to the nerve compression, then the osteosclerosis, osteoarthritis, malignancy, that is osteosarcoma is more common than the fibrous sarcoma, chondrosarcoma, and sarcoma of the myeloid and mesenchymal elements, high output cardiac failure. In treatment, drug of choice, it is a bisphosphonate, zoledronic acid is preferred one, and salmon calcitonin is more effective than the procaine calcitonin.